Good afternoon to those of you in the same time zone. I'll say good afternoon, good morning, or good evening, wherever you are. My name is John Balbus. I'm Senior Advisor for Public Health at the National Institute of Environmental Health Sciences. And as co-chair of the Institute of Medicine Global Environmental Health and Sustainable Development Innovation Collaborative, I want to welcome everyone to this third of 3 webinars that we're producing this spring and summer. The dates for the previous webinars are up on your screen, and we look forward to your participation in our discussions today as we focus in on health in the context of the post-2015 development agenda. A primary theme of the Innovation Collaborative on Global Environmental Health and Sustainable Development has been addressing the global burden of disease related to environmental exposures, and especially trying to assure that the global economic development efforts underway around the world are informed by an understanding of the linkages between environmental exposures and health, and that built into the system of economic development are ways to measure that impact and especially to prevent adverse impacts. The 8 Millennium Development Goals, which have galvanized global efforts to meet the needs of the world's poorest, as you know, are set to expire in 2015. The United Nations and its partners have developed separate work streams to consider on the one hand, the post-2015 Millennium Development Goal future, independently from a process that was set in place at the Rio meeting, looking at sustainable development goals, and ultimately to converge these 2 threads into one unified development agenda in order to continue the wonderful progress that's been made under the Millennium Development Goal programs. In July of last year, in 2012, a high-level panel of eminent persons, which included representatives of governments, from the private sector, academia, civil society, and youth, was convened and tasked to make recommendations for a post-2015 development agenda. Their report was released recently at the end of May this year, and it's titled A New Global Partnership, Eradicate Poverty and Transform Economies Through Sustainable Development. So that's one thread or one important stream of work that's leading into this unified development agenda. And in addition, the United Nations Development Group initiated what are called open thematic consultations. So open consultations on the various themes of economic development, some of the sectors and some of the other thematic elements, in order to facilitate a global conversation about these themes and what are the appropriate goals and indicators. And one of those is focused on health as a theme. And it's these 2 work streams that have been set in place independently that are the primary focus of today's webinar. Now, those of you who have been tuned to this webinar series know that last fall we had a series of 3 webinars that were also addressing some of the aspects of this process, talking about the UN process, talking about what might be reasonable indicators, and talking about some of the social and social justice aspects of these processes. So we've come back now in July of the summer as we've moved forward in the process, and we hope that this webinar will update everybody and provide us with a good set of information and the latest thinking in this as we go into the final round of setting these goals and indicators for development that will be put in place post-2015. We especially hope that the report that summarizes all of these webinars will provide useful information to the countries of the world as they become the body that deliberates on the goals and indicators for development. So this webinar, as I mentioned, is the third in a 3-part series. These webinars have been coordinated by the Institute of Medicine's Roundtable on Environmental Health Sciences, Research, and Medicine, in partnership with our hosts today, the Pan American Health Organization, and also my employer, the National Institute of Environmental Health Sciences. So with that by way of introduction, let's move right on to our first speaker. Our first speaker today is John Norris. And John is the Executive Director of the Sustainable Security and Peacebuilding Initiative at American Progress. In that role, he served as Senior Advisor to John Podesta during his work on the Secretary General's high-level panel on the post-2015 development agenda, which we just mentioned. He served in a number of senior roles in government, international institutions, and nonprofits, including as Executive Director of the Enough Project at American Progress. John was also the Chief of Political Affairs for the United Nations mission in Nepal, as that country tried to emerge from a decade-long war. He's got extensive experience as a Washington Chief of Staff for the International Crisis Group, and has also served as Director of Communications for the U.S. Deputy Secretary of State, Strobe Talbot. John's the author of several books, including The Disaster Gypsies, a memoir of his work in the field of emergency relief, and Collision Course, NATO, Russia, and Kosovo. And he's published commentaries in the Washington Post, Los Angeles Times, Wall Street Journal, and elsewhere. Very happy to have John here, and we look forward to your speech.
Thank you, John. It's a pleasure to be with you today. I wanted to start the discussion today by touching on some of the big framing issues that really, I think, profoundly shaped how the UN High-Level Panel approached its work in shaping the post-2015 agenda and hopefully making a substantial contribution to the intergovernmental dialogue and negotiations that are ongoing now. I think it's really important to recognize that when the panel first began its work at the tail end of last summer, the mood was pretty sour, that there was a lot of disappointment coming out of Rio. There was a lot of hurt feelings out of the process. I think a lot of people felt that the Rio summit had been something of a train wreck. And I must say that dealing with different government delegations, people involved with the panel's work, you could still see that sense of loss and disappointment was quite raw going into the process. And I think more broadly, there was a real sense that multilateralism itself had been having a very difficult stretch of years, that discussions on a climate treaty, WTO rounds, on international finance for development, all had essentially stalled. So I think there was a real desire by everyone on the panel to try to revive a sense of successful multilateralism. The panel and its 27 members were drawn from a very diverse bunch of states. Some were closer to their governments, others had more distance, but I do think they really shared a common desire to build on and expand what I think was the relative success of the MDGs. I think there was a real common desire among all panelists to build on what has worked out of the existing MDGs, to preserve those parts of the agenda that have been effective in galvanizing an international response on health, on education, on the environment, but also to be pretty honest about those areas that haven't been terrifically effective in the agenda. And I think there are a couple areas that really stand out in terms of what the MDGs have done well and not done well. I think obviously on health, education to access, we've seen some pretty historic advances over the period of the MDGs. I think on the environment, we've seen far less salutary record. And I think the other part that really stands out looking at the track record over the last 13 years is how wildly uneven the implementation of the MDGs has been. An awful lot of the progress that we've seen has occurred in China, has occurred in India, Brazil, a couple very large countries that moved into middle income status, were able to lift hundreds of millions of people out of poverty. But even within those countries that have been fairly successful, the record with traditionally marginalized populations has been very uneven. Those people that had the misfortune to be from the wrong ethnic group or the wrong caste or live on the wrong side of the mountain continue to often be left behind as we struggled to deal with poverty and these other issues around the globe. And I think the other issue that really came out of Rio and really shaped an awful lot of the debate and the panel's work was what I think was a very considerable but false tension between the anti-poverty communities and the environmental community writ large. I think the Africans in particular were worried that an increasing focus on climate, environmental issues, and sustainability would divert money from efforts to eradicate extreme poverty. I think that the global environmental community had some of those fears in reverse. I think both communities somehow mistakenly was convinced that the other community sat atop piles of funding and riches that somehow were being deprived from each other. And I think trying to bridge that gap was very central to the panel's work. The last big trend that I think is really important in acknowledging how the panel approached its work and its agenda was an understanding that the world is very different than it was when the original MDGs were put into place. First and foremost, the MDGs, as they were originally crafted behind closed doors, largely by a handful of representatives from the UN, some key member states, international financial institutions. There was a real desire, and I think it has been largely carried out, to make the post-2015 agenda far more consultative, built on the hopes and aspirations of the poor themselves, to open the doors, to listen to what civil society, implementing partners, private philanthropy, the business community had to say about the post-2015 agenda. I know that just in our work, my work with John Podesta on the panel, we conducted more than 100 different consultations with civil society, with different sector expertise, with philanthropy, with business community. We worked really hard to listen. I think most of the other panelists took a similar approach. The UN has held a series of country consultations in more than 100 states around the globe, as well as had major thematic consultations as well. And I think that's changed the dynamic and changed the agenda in some very important ways, and will really apply some fairly unique pressure on intergovernmental negotiations as we move towards the end game. And I think there is also an understanding that official development assistance, even though it preoccupies many of our day jobs, is a smaller and smaller piece of the overall pie, going to environmental issues, going to health issues, going to development in general. ODA now represents just about 13% of the flows that are being directed toward dealing with development globally. Foreign direct investment, domestic resource mobilization, private philanthropy are a bigger and bigger piece of the pie, and I think there is a real desire to reflect that in a post-2015 agenda and to have those flows figure into the conversation in a constructive way. So what came out of all of this? The panel, I can say, took its work very seriously. There were meetings, 4 or 5 meetings in New York, meetings in Indonesia, Liberia, the UK, reflecting the fact that the chairs came from those 3 countries, scores and scores of consultation, endless numbers of drafts, and a lot of intensive debate in all of those sessions. And I think the report that came out of it, well, sausage making is never easy, I think did pretty well, but I'm certainly eager to hear people's views and opinions of it. And I think the first and probably foremost achievement of the panel report was that I think by and large it successfully bridged that gap between the anti-poverty and environmental communities. The panel reports set the top-line goal of eradicating extreme poverty by 2030, making it so that no one in the world is living on less than $1.25 a day, but making very clear that this needs to be nested within a framework of sustainability if it's going to be effective, and a clear recognition that the poor are often most vulnerable to the changes that we're seeing take place in the environment, to climate change, to the loss of safe drinking water, to growing deserts, shrinking forests, and that we need to deal with these approaches in tandem. I think the probably most revolutionary part of the report is that this is a truly universal agenda. It is an agenda that is designed to be applied to every country on Earth. The original MDGs were largely designed by donor nations to deal with recipient countries. And I think everyone around the table agreed that moving forward, the ideal was to have a single global development agenda where every country had work to do at home, but also could make contributions abroad, and to move beyond, I think, a fairly narrow north-south lens of the world. And I think it only makes sense given that we've got countries like Brazil that are emerging donors, but also have very significant problems in terms of dealing with poverty at home. And I think that this focus on universality moved the conversation in some different and important ways. And I think the willingness of the United States and the OECD in particular to look at some of their own environmental problems, to look at their own patterns of production and consumption was really important, particularly in helping bring along key Latin American actors on the panel, Colombia, Brazil, Mexico, and Cuba, and making clear that they were willing to take serious steps to deal with some of those forces that are really driving climate change and global environmental degradation. I think that the emphasis on environment comes out both quite strongly in the narrative as well as in the specific goals and targets. I think in a very welcome development, environment is not just dealt with under a single goal. You can find it spread across a large number of goals and targets. And I think there was a real conscious effort, not just on the environmental side of issues, but in all the thematic and sectoral issues, to take an approach that was less stovepiped than the original MDGs, and to try to figure out goals and targets that really sat at the center of the web of development, and ones that you could only move by getting a lot of different things right. I think that's a very important approach to development, and I think it's also very important in building a broad consensus for the goals and targets. If you look at an issue like stunting, one that is a profound problem, not only do you have to do a lot of things in a society right to actually move stunting numbers, but we found that it was one that had broad support because it not only brings along the general health community, it brings along the education community, it brings along people who care about children. There's real benefits in terms of cognitive development. There's real benefits in terms of countries' long-term economic prospects. People who care about peace and security issues know that if you're dealing with stunting, you're probably have an ability to intervene pretty early in a crisis situation. So I think that kind of approach of trying to figure out a very integrated and much more systems approach to development, to health and the environment is really woven throughout. I think if you also look at the agenda, the other part that really is striking and a major departure from the original MDGs is an emphasis on institutions, on governance, and on peace. And obviously, I think some in the environmental community and some in the health community will go through and look just specifically at targets that they feel relate most directly to their work. But I think there is real reason to more broadly support that emphasis on peace and institutions. More than 40% of the world's poorest of the poor now live in conflict-affected and fragile states. We're simply not going to be able to deal with some of these issues if we don't figure out how to do a better job helping countries emerge from conflict. And I would also argue more broadly that issues like budget transparency, a more informed and connected public really does have a very powerful impact on allowing citizens to influence governance and to help their governments make better informed, better choices that go to how we use the environment, how we allocate money in terms of health spending, how we invest in people. And I think that is potentially very important. But I know those will also be very hot-button issues as we get into intergovernmental negotiations. And there are certain member states, obviously, that would like to strip out anything relating to institutions or anything relating to peace, which I think would be a mistake, and I think would receive a very negative reaction from global civil society. Drilling down a bit into the specific goals and targets, I want to stress that this process was one based on consensus. There was a lot of horse trading. We had so much input from civil society. If we'd reflected all of it, as well as the input from different governments and members of the panel, we could have had scores of goals and hundreds of targets. But I think, obviously, there had to be hard choices. It had to be things that were boiled down, and you wanted an agenda that was still clear and concise enough that it really did carry some power, as did the original MDGs. I think if you look at the specific health goals and health targets, there's a lot of continuity with what was in the original MDGs. We see an expanded emphasis on infant and child mortality, preventing preventing deaths for those under 5. We see an emphasis on maternal mortality. We see an emphasis on sexual and reproductive health and rights. I think all of those were areas where some progress was made in the original MDGs, but a lot more needs to be done. I think the addition of NCDs, non-communicable diseases, is very important in terms of environmental health. I'd like to see this focus actually expanded, and I think that's something where all of you who are listening in today, frankly, still have some work to do. There was an emphasis in discussions and negotiations on potentially including healthy life expectancy as a target. I personally think it is one that should have been included. I think that healthy life expectancy probably is the best way to capture changing health dynamics across the full range of the development continuum in designing a target that would have real power in a developing country, in a middle-income country, in OECD countries, that would allow you to deal with things like tobacco use, obesity, air quality, even road safety in ways that are, I think, pretty significant. I think one of the challenges and one of the reasons that healthy life expectancy wasn't ultimately included as a target was that as a concept, it's fairly young. And I think that in the high-level panel, there was really a divergent level of expertise among the panelists. Some who had significant resources and staffing behind them, some who didn't. The idea of healthy life expectancy is a fairly new concept. It's one that lots of policymakers, permanent representatives, foreign ministries aren't particularly conversant in or comfortable with. I think it is a good one, but I think there is some real public education that needs to be done within the intergovernmental process to get people more comfortable with this idea and to demonstrate that healthy life expectancy is a pretty good proxy indicator for a lot of different things that we're trying to achieve across a lot of sectors and in a lot of different countries. Touching more broadly on the environment, I think dealing with environmental issues was a complex one. I think it came out reasonably well. And I think it was shaped by an understanding that the work of a high-level panel, the work of the post-2015 agenda would not serve as an effective substitute for global climate negotiations. It couldn't serve as a substitute for global trade talks or global discussions on finance, but it could be designed in such a way that it gave those discussions and negotiations more momentum, more impetus, and really tried to codify some areas where there has been emerging consensus. So I think if you look at the agenda that's laid out across the environmental targets, you see the sustainable energy for all commitments in terms of doubling the rate of renewables in the global energy mix, doubling energy efficiency on a global scale. I think there's already a lot of support for SE for all. This is an effort to push it even further. The effort to get rid of fossil fuel subsidies. It's a big dollar issue. It's between $400 million to $400 billion to $1 trillion, depending on how you count it every year. That's money that could be potentially reinvested. It's got a big impact not only on finance, but also in terms of obviously ending a very destructive environmental practice. That commitment has been made at the G8 and the G20 level. It hasn't moved very far at this point. It's one that we hope we could see move further along. I think other areas that I think were really important, and again, designed to have a multi-sectoral impact, things like reducing post-harvest waste, increasing agricultural efficiency, sustainable fisheries, improving water and sanitation. These are things that have a very big impact on the poorest of the poor. These are things that have a very big economic impact. These are things that have real implication in terms of infrastructure, and I think that there's a lot of popular support for. Again, the concept of sustainable consumption and production was woven throughout the narrative, and I think it is woven throughout the goals and targets. The last goal that I specifically wanted to touch on, because it's one I think where the environmental health community particularly has a lot of work left to do, is Goal 9 on the environment specifically. There's commitments there in terms of dealing with deforestation, safeguarding ecosystems, making public procurement sustainable, dealing with the growth of deserts. They're not very data-driven right now. There isn't very good numbers beneath those targets. There wasn't very strong agreement in terms of what numbers under those targets would potentially look like. And if there aren't clear numbers, if there isn't agreed upon data or measures for those, I worry that those specific environmental targets will be every bit as ignored in the post-2015 agenda as they sadly were in the original Millennium Development Goals. When you're talking about things like biome loss, what is an appropriate target? You can't say zero species loss because we probably would fail in that on day one in 2016. What is an acceptable level of biome loss? I don't think member states have a very clear agreement, even in terms of how you would define what deforestation means, what forests would come under that, worries about land use, legal implications of that for both developed and developing nations. There's an awful lot of work to reach consensus in this area. There's an awful lot of work that needs to be done on the data side. Lastly, and very briefly, I would just also note that as intergovernmental negotiations come together in what is hopefully a single set of development goals for post-2015, we also need to see the financing track come together. I think there probably is a willingness to look at environmental issues and poverty reduction issues in a single stream within the UN, but I also think for this ultimately to be successful, that financing discussion has to be much more broad than has traditionally been the case. It can't just be member states and the international financial institutions. It has to include the private sector. It has to include private philanthropy. It has to include private sector and civil society if we are truly going to galvanize the kind of support and mobilize the resources that we need to meet what is a very ambitious agenda at the end of the day. Thank you, and I look forward to any questions.
Great. Thank you very much, Mr. Norris. That was a fabulous presentation. I think we are going to hold questions until the end for you and for Dr. Rasanathan, and I guess Dr. Haynes is the third speaker, and we'll have his questions right after him. So I'm sure there will be a lot of discussion. There was a lot of very stimulating information there, and we'll come back to that. So it's now my pleasure to introduce Kumanan Rasanathan, our second speaker. Dr. Rasanathan is a public health physician, currently works as a health specialist for UNICEF on district health system strengthening in order to improve the delivery of maternal and child health services in Asia and in sub-Saharan Africa. He's also the UNICEF focal point for health in the post-2015 development agenda and was a member of the task team managing the global thematic consultation on health for the post-2015 discussions. So we have representation from the Imminent Persons Report, the Eminent Persons Report, and also now from the Global Thematic Consultation on Health. Prior to joining UNICEF, Dr. Rasanathan worked for the World Health Organization on primary health care and social determinants of health. So we're very happy to have you, Kumanan, and you can now begin your presentation.
Thanks, John. It's a pleasure to be here today, and greetings to everyone wherever you are. I'd like to just take off from where John has left it, looking at where we are at the moment in terms of the discussion on health in the post-2015 agenda, and maybe identify what I see as some sort of entry points developing potential targets and indicators for environmental health agenda, and then I'll leave it to Professor Haynes perhaps to discuss those potential targets and indicators in more detail. I think thanks to John for providing, I think, a very good overview, obviously being so intimate with the high-level panel process. I think I'm just going to give, this is very much my personal views as someone who's been as part of the thematic consultation and processes unfold. It's not necessarily a UNICEF corporate view, but it's my sort of personal reflection. I think first to say I certainly agree that the high-level panel, I think, has done a very good job and probably has sort of exceeded expectations. There was a lot of concern or worry that would the panel be able to come together with so many different views, which is a broad and difficult task. But I think it's fair to say that the panel has put on the table coherent both intellectually, but also I think politically, sort of vision of what an agenda could be like, which is a very, very, very useful input for as we now move the focus of this process into the intergovernmental discussion, which is sort of centered in the first place in the so-called working group on sustainable development, which had its session on health last month here in New York. That's very much a country government or member state driven process. And that's where the focus will be now leading into the general election in September and then onward, hopefully to get an agreement by the end of 2015. But I think the high-level panel has taken a very of issues, distilled them with the sort of 5 questions, but also had the courage to put on the table a set of illustrative goals and targets. And I think that's valuable. In essence, what we're trying to do, as I said, is build on what we've achieved with the MDGs, and we shouldn't forget that we've still got a couple of years to go, and we need to accelerate efforts as much as to get to achieve the MDG targets or get as close as possible, and that this process shouldn't distract from that very important work. But certainly people seem to see a lot of in the MDG process and the existence of specific quantitative goals for key issues, to have a global consensus on those issues and what needs to be done, and comparison between progress between countries. I think people see that that has been extremely valuable, in some ways unique, and we want to preserve that, but then perhaps some of the issues that weren't well in the MDGs, the challenges of equity, the need for a unique agenda, the need to consider how the world has changed in terms of the flows of power and governance, and then perhaps, as John said, the need to take a more coherent look at the way we address development issues rather than seeing them in terms of specific sector silos. As always with complex like this, sometimes this can be a little bit true. And
I'm sorry to interrupt you here, but just with the telephone quality, it's a little hard to hear you and to translate. So I'm just going to ask you to speak a little bit slower.
Sure. Okay.
Oh.
Very happy to do that. So that there's a challenge in keeping the specific and quantitative value of the targets under the MDGs, but then addressing some of the more issues that we need, for example, around the role of institutions and on the role of governance. And we note that perhaps some of the more difficult progress in the MDGs was perhaps, for example, in Goal 8, which was not as specific, which was not as well defined with sort of quantitative indicators. So that's going to be a challenge as we go forward, and that the high-level panel has very bravely taken on board. We're going to have to address that if we want to be confident that we'll see progress and have the same impact that the MDGs have had. So before, I'm going to sort of look at where we are with the health targets and indicators and what the current thinking. But it's worth looking at this quite complex process. In response to the critique that the MDGs were too top-down, that they were conceived behind closed doors, I think the Secretary General has convened an impressively participatory process. That is possible. I mean, it's never perfect, but there are multiple streams. The huge array of consultation and work that fed into the high-level panel, including the country consultations, thematic consultations, regional consultations, a lot of civil society interaction, work of the Open Working Group, and bringing those together. And there's a whole range of other processes as well. For example, the work of the Global Compact, the Sustainable Development Network. Civil society is extremely well organized, and it will be a real challenge to bring all of that together. But I think people should be encouraged that this is a much more participatory, open and transparent process than that which led to the MDGs. Of course, the challenge with that is, as some people have concerned, that we will end up with the Christmas tree. We will end up with such a long list of potential targets and indicators to satisfy everyone that it'll be very difficult to act, and we'll lose that the MDGs gave us. And I think in that sense, the high-level panel giving some suggestions for how to bring that together has done us a tremendous service. As part of that process, UNICEF, WHO, Botswana, and Sweden conducted and managed the global thematic consultation on health. Many other partners in civil society, other member states, other UN agencies. We had a website, www.worldwewant2015.org/, which was visited by over 150,000 people. We had a number of face-to-face consultations in all continents with all groups. And we had a very open process. We put drafts of the report on the web for further comment. We had over 100 papers, very from institutions that are also on the web. And then we had a meeting very kindly hosted by the government of Botswana in March, which brought together members of the high-level panel, member state representatives, civil society representatives, the leaders of the so-called H8 peak health agencies, the UN health agencies, the Global World Bank, etc., and also key academic leaders. And they all came together, had the same speaking rights, and sort of discussed what was the consultation. And from that, we produced a report which was submitted to the high-level panel and the Secretary General, focusing on these 5 areas: lessons learned, health MDGs, health priorities in the post-2015 era, the role of health in the broader post-2015 development agenda, potential goals and targets, and also some thinking on what have we learned about the implementation science of goals and targets from the MDGs. How do we implement these goals and targets? How do they make a difference? Which was not something that the MDGs, when they were conceived, focused on. Now, the report's on the web, but I'll spend a little bit of time discussing, well, what was the sort of consensus thinking coming out of this consultation. Not everyone agreed, and there were a whole range of proposals, but there was much more consensus than we might have thought. I think in the first level, there's this idea that we need to think about not just in terms of what we achieve in the health sector, but as a contribution to sustainable development and well-being in general. It's a very important contribution, but that it's not the only thing we need to focus on, and that other themes, other key issues such as education, such as the environment, nutrition, such as also contribute. And there are links between all of these. And that health is both a contributor, but also a consequence and indicator of sustainable development. So health benefits from the efforts and other themes. But health, and you might say the definition of health, is also a very useful indicator of how well we're doing in sustainable development. And then in terms of a health goal, we recognized that we were unlikely to see 3 narrowly specific health goals in a new agenda, that probably, while still a widespread recognition of the importance of health, we were only likely to see a single overarching goal. And the key issues underpinning that came across were the need to build on the so-called MDG health agenda in terms of child health and survival, in terms of HIV, malaria, and neglected tropical diseases, but that we also needed to address issues that weren't included in the MDGs, in particular non-communicable diseases. And that whilst there was a lot of value in outcome goals, in that goals and targets expressed in terms of lives saved or improved quality of health were understandable to people. That's what people valued. They were things that were politically sellable, but also things that made sense to ordinary people. We also perhaps needed to consider a little bit more the means within the sector, and there this very strong momentum around universal health coverage. The ability for everyone to access and use services they need for their health in a manner with good quality. And as you know, there was a General Assembly resolution which referred to universal health coverage last year. And there's a lot of support. Now, this is not exhaustive, but these were the three sort of main areas that attract most support. But at the same time, we also needed to consider the contributions of other sectors to health, the so-called social determinants or people's living conditions, the aspects of health which are created and destroyed beyond the health sector. And so we need to look at how targets, goals, and indicators across the agenda also impact on and contribute to health. Specifically for the health goal, in the end, the sort of overall goal was maximizing healthy lives, expressed as increased number of healthy years, life lived at all stages. As John mentioned, one potential measure of that could be healthy life expectancy, but there are a lot of challenges with that. Firstly, the methodology is probably not sufficiently developed as yet. There are a lot of challenges in sort of the data we would need, especially in a lot of low and middle to make that a reality. But it is attractive in that it can bring together all health issues and impacts on health. But whatever you call the overall health goal, in some ways what could be more specific is the targets. And we suggested two sets of outcome targets, one on building on the MDG, but with more ambitious targets. So now ending preventable maternal and child, universal access to sexual and reproductive health services, and building on the targets for HIV, TB, and malaria, but also reducing the burden of major non-communicable diseases and building on some of the discussions that have already occurred. And at the same time, also a set of potentially on universal health coverage and access. Now, these targets still need to be developed. In particular, WHO are doing work on this, but looking at both the coverage of services, the affordability, financial protection, preventing people going into poverty due to the cost of health services, and looking at issues of quality. And so we were pleased when the high-level panel's report came out, because we felt that they had sort of taken note of some of this work and the input into the consultation. And certainly many of the outcome targets that were under the health goals specifically were strongly aligned. I suppose to comment what we might say, and as John mentioned, obviously different interests that had to be aligned in the high-level panel. The focus on non-communicable diseases perhaps could have been stronger, and particularly trying to address some of the risks for non-communicable diseases. And whilst the narrative in the high-level report strongly identifies the importance of universal health coverage as means, with no targets included for universal health coverage, except, interestingly enough, for immunization. And that has certainly caused a lot of concern from the proponents of universal health coverage and from a lot of countries, certainly in the open working group session. A lot of countries expressed their concern that universal health coverage wasn't put forward as I suspect as the discussions go forward, we'll see greater discussion on how to address NCDs and to include universal health coverage as targets. And partly that relates to the fact that, as I said, on indicators for universal health coverage still needs to be done and completed. But of course, as John mentioned, health is not just about the health sector. And in many of the other targets, as I've put here on the slide, you can see the strong contribution to health. And this is not exhaustive. Issues like reducing deaths from natural disasters, addressing smoking, water and sanitation, birth registration, reducing violent deaths, and addressing climate change are hugely important to any post-2015 health agenda. And it was good to see these targets the agenda. The Sustainable Development Solutions Network, their goal that they put forward in their report was achieve health and well-being at all ages. Again, strongly aligned to the discussions in the health consultation around universal access to primary health care, NCDs and communicable diseases, outcome targets, maternal and child health and NCDs, but they also suggested targets on addressing risks for particularly non-communicable diseases. So I think there is an emerging consensus from the to now on what are the key issues that must be included in the agenda, building on the MDGs, but not being more ambitious, achieving targets as soon as possible, but then being more ambitious, addressing non-communicable diseases and their risks, looking at health systems under the banner of universal health coverage, the need to address equity through dating all of our targets as called for by the high-level panel and not being satisfied unless we achieve the target for all groups, and then health targets for actions in the health sector, the so-called determinants of health. And so as we look, the process continues, and it still has a very long way to go. If you like, we're sort of still in the qualifiers for the World Cup football, which are very important for a long time, but we still haven't quite got to the main, which will start perhaps in September at the General Assembly and go forward with the inputs from the Open Working Group and the discussions, very much focused mentally, but with inputs from the private sector, from civil society, from UN agencies, from academia. And in terms of where environmental health can sort of position itself, it's firstly, there are many countries that do have an attention to environmental health, considering this in their positions, which are still being developed. And so looking at how people can work within their countries to influence those positions. For all of us, there's still a lot of technical work to do. Whilst developing indicators is a difficult task, putting those indicators on the table has a lot of political import. And what we've seen so far, including in the panel's report, is that where there are indicators on the table with a good rationale, where there are targets, for example, preventable child death, where there's a lot of work and momentum already, it's easy for that to be taken forward. Where there aren't indicators clearly identified, for example, for UHC, difficult to take that forward politically. So I think, you know, the environmental health community should look at, well, what are potential targets? Are they happy with the targets that are already being put forward? Are there omissions? What could we see? Also, the sort of implementation of how do we, you know, achieve the links between different sectors and between different goals and targets. And finally, managing the technical work of managing the transition from the MDGs happened on the 1st of January 2016. And I think the final thing I'd say is that for the environmental health community, do you want to see separate goals and targets? Do you see the best opportunity to put targets within a health goal or within other? For example, goals around indoor air pollution or air pollution, they might be found under an environmental goal or under an energy goal, just to think strategically what's the best place for those and to put forward potential targets and indicators on the table. So all of the and reports from our health consultation are still available on the web at www.worldwewant2015.org/health. And thank you for your attention, and I look forward to Professor Haynes' presentation and then the questions and discussion after that. Thank you.
And especially, at least from my viewpoint, encouraging to see that this process is taking this broader view of health. It's looking at the role of the various social and environmental determinants and trying to work out where to incorporate those and to have a nice integrated set. So wonderful presentation, and appreciate hearing that. And now to help us further integrate and consider what we've heard and to provide a response to the two presentations and especially to the report of the eminent persons. It's my pleasure to introduce Dr. and Sir Andrew Haynes, who's a professor of public health and primary care in both the Department of Social and Environmental Health Research and the Department of Population Health at the London School of Hygiene and Tropical Medicine. Dr. Haynes is previously the director and the dean of the London School of Hygiene and Tropical Medicine for almost 10 years, and before that was a professor of primary health care at University College London between 1987 and the year 2000. He's been a member of a number of major international and national committees, including the MRC Global Health Group, the MRC Strategy Group, the University's United Kingdom Health and Social Care Policy Committee, and the World Health Organization Advisory Committee on Health Research. He has been a member of the UN Intergovernmental Panel on Climate Change for the second and third assessment reports of that body, and is currently a review editor for the fifth report. It's a pleasure to have you with us today, and Andy, please begin your presentation.
Well, many thanks, John, and hello everyone. It's great to be talking here and following two very, very interesting presentations. So let me start by saying that I think there was concern when people were looking ahead from the MDGs that health would be somewhat marginalized. And of course, there were 11 thematic groups for the consultation that we've heard about. Only one of them was on health. And I think a number of people in the field of global health were concerned that health might be marginalized in the Sustainable Development Goal process. But if we take a broader view of health, I think we can say that there's still a lot of options for health and a lot of ways in which health can be integrated into these broader Sustainable Development Goals. In the MDGs, as we know, 3 of them were specifically concerned with health, and 18 of the 48 indicators were specifically linked to health. Many of those were indirectly linked. So although the direct links with health in the SDGs may be somewhat less, nevertheless there's a lot to play for in terms of influencing the social, economic, and environmental determinants of health. We've already heard that there's likely only going to be one specific health SDG, and this will need, as far as possible, to integrate both universal health coverage and the determinants of health. We've heard already that there are problems with developing a simple set of indicators for universal health coverage, and that's not the main focus of our discussion today. But it is noteworthy that the UN High-Level Panel, for example, did not include catastrophic health expenditure, which is an important element of universal health coverage. And so maybe that's a discussion that needs to continue. So we've heard about the 12 proposed illustrative goals, and many of them, as we know, are very inextricably really linked to health. Of course, Goal 1, ending extreme poverty, is crucial for improvement of health. We've heard a bit about Goal 4, what I would call the MDG Plus. They add vaccination. They also add non-communicable diseases, as we've heard. And I think there's an opportunity there with non-communicable diseases to develop indicators which also reflect some of the environmental determinants of health. And I will say a bit about that in just a moment. In Goal 5, which focuses on ensuring food security and good nutrition, it's quite striking that the focus is very much, understandably, I guess, on reducing stunting, which is absolutely vital, wasting and anemia. It doesn't say anything about the other end of the spectrum, which is overweight and obesity. And of course, we know that's driving an epidemic of diabetes and other non-communicable diseases in many middle-income countries, and increasingly too in the urban centers of low-income countries as well. So this is, I think, an area that we ought not to neglect, and may come up in future discussions about the more specific indicators for the MDGs. Goal 7, I think, is potentially very importantly related to health. It talks about universal access to modern energy services as one of the potential areas, doubling the share of renewable energy. And of course, we know that many renewable energy sources are responsible for far less air pollution than many fossil fuel sources. So again, there are important links there with health. Goal 11 talks about ensuring stable and peaceful societies, and mentions specifically reducing violent deaths by 100,000 as a possible indicator. And obviously that's desirable. But there's also an opportunity perhaps to bring in road injuries, which, as we know, are responsible for about 1.3 million deaths a year. And we also know that road transport is increasing. It's a source of greenhouse gas emissions. And any of you who go to lower middle income countries will see at first hand the dangerous state of the roads in those countries. And the fact that it's not just causing road injuries, which is a major burden on the often fragmented health systems of those countries, but also, of course, it inhibits active travel, in other words, walking and cycling, because it's often people who are walking and cycling, pursuing active travel, that are often the most vulnerable to road traffic injuries. So again, there's a link there with some of the broader environmental issues. Goal 12 mentions the importance of keeping the global average temperature below 2 degrees. There's a kind of consensus amongst many climate scientists that above 2 degrees, you get the potential for all sorts of changes, which may be irreversible, non-linear changes, which could threaten global security and indeed health in the future. And of course, it's become increasingly apparent that the trajectory that we're on will actually take us above 2 degrees. It looks, for example, as though by the end of the century, it is quite feasible that we could have 4 degrees warming. And indeed, the World Bank, in its wake-up call recently, a report called Turn Down the Heat, suggested that we could well be on target for 4 degrees centigrade and beyond that in the next century. So we are very far away indeed from sustainable development. And we are on a dangerous course, I think, of climate change, which takes us, I think, largely into, if you like, uncharted territory, but certainly with major implications for health and development. And although the UN high-level report did refer to this and referred to the importance of, for example, abolishing fossil fuel subsidies, it was very interesting to see my own government just a few days ago, a week or so ago, suggested that they were prepared to increase subsidies or to introduce subsidies for fracking. So it's quite, as we know, there's often a discontinuity between what's said in a high-level fora and the actual policies of governments. And in fact, subsidies for fossil fuels have, and indeed for unsustainable agricultural policies, have proved remarkably difficult to eradicate because there are so many vested interests that are not prepared to lose the potential for making very large sums of money out of these subsidies. So I think we need to be asking ourselves, how will breaching some of these ecological boundaries, such as those that were described by Johan Rockström and his colleagues in their seminal paper in Nature 2009, how might breaching these planetary boundaries affect human health? They outlined these 9 planetary boundaries, which I won't read out, but 3 of them they said we were breaching already, and others we were about to breach. Climate change is the most perhaps notable of them, but there's also the nitrogen cycle, resulting in natural loading of the environment. Biodiversity loss, which has a whole range of indirect linkages with human health. And of course, there are others, such as ocean acidification, that could have very wide-ranging impacts on human health because they affect marine ecosystems, although we don't have well quantified impacts on human health at the current time. So this is a challenging agenda, and we need to think about how to reflect the impacts that some of these global ecological changes might have on health, and to try to decide what kind of indicators might reflect the damage to these global ecosystems. This slide is from UNDP and just shows you the potential changes in cereal grain yields over the next few decades with climate change. And what you can see is that there could well be really substantial reductions in grain yields over the next few decades, particularly in many low middle income countries. And of course, as we move into the second half of the century with even higher levels of temperature increase, it's quite possible that even in higher latitudes we may not see increases in grain yields or crop yields. We may see a plateauing or even a decrease in some areas. So there are some seriously concerning unsustainable trends, I think, in agricultural production, partly, but not entirely, as a result of climate change and other environmental changes. We know from the IPCC, the previous report, that it's likely that water availability will change in different parts of the world, and this map just shows you where a number of climate models suggest fairly consistent patterns of rainfall. We know that precipitation is quite difficult to model, there's a lot of variability, but this is where there was reasonable consistency between different climate models. So the brown and reddish show you where precipitation is likely to decrease, And the blue, the different color blue, shows you where precipitation is likely to increase, with the darker blue indicating higher intensity of precipitation. So this does suggest that there's likely to be increased precipitation in parts of the world with the potential for increased flooding, but then decreased precipitation in other parts of the world, including areas like Mexico and the southern parts of the US, around the Mediterranean, North Africa, parts of Australia and southern Africa and so on. Many of these, of course, important food-producing areas as well. So the combination then of increases in temperature with changes of precipitation does pose really major stressors for crop yield and for health more generally. So one of the challenges, I think, is to think of potential indicators that link health and sustainability. And one could conceive these as perhaps reflecting two broad types of indicator, reflecting two broad types of policy. One type of policy might be a policy that enhances sustainability, perhaps by reducing greenhouse gas emissions and also improving health. So one can think here, for example, of reduced combustion of coal, which is a major contributor to greenhouse gas emissions, but also, of course, is responsible for large amounts of fine particulates, which have major impacts on health. And then there might be another kind of policy which increases the resilience of populations to adverse environmental conditions. So policies, for example, which result in the sowing of seeds which have greater resilience, of crops that have greater resilience to temperature and to changes in precipitation. So there are many links, of course, between agricultural systems and human health through nutrition, and also through environmental change. We know that, for example, agricultural systems, including livestock production, are major contributors to climate change. And the estimates vary depending on whether you include land use change or not, but if you include land use change, it could be up to 30% of greenhouse gas emissions. And quite a large proportion of that, of course, is due to livestock. Ruminants, for example, because they produce methane, but also, of course, we are deforesting some parts of the world, for example, parts of the Amazon, to grow soy, to feed to poultry and other livestock. So there are a range of linkages between agricultural productivity and agricultural systems, environmental sustainability, and human health. And at the same time, of course, as about 1 billion people are food insecure, we're also feeding large amounts of grain to animals. And of course, because of the conversion inefficiencies, that means that large amounts of grain that could be feeding people is being fed to animals. And so we're losing that possibility of producing more food for individuals. So, for example, it takes about 8 pounds of grain to produce 1 pound of ruminant meat, and about 3 pounds of grain to produce 1 pound of pork, something of that order. So there are considerable inefficiencies involved, as well, of course, as the increase in greenhouse gas emissions. So all of this means that we need to develop better indicators, I think, to link food and agriculture. Stunting is very important, and it's quite right that that's the focus of the indicators so far. But perhaps we also ought to consider body mass index, because that integrates, obviously, nutrition and physical activity. It's due to an imbalance between energy in and energy out. Interesting enough, some of my colleagues at the London School, Phil Edwards and Ian Roberts, have also suggested that people who are overweight and obese are also likely to contribute higher per capita greenhouse gas emissions, because they tend to consume more food, and also they require more energy to move around. And so there may be links there between BMI and environmental sustainability that we haven't thought of until recently. At the same time, it's still quite difficult to think of easy to apply metrics that would link agricultural sustainability with health. Quite difficult to develop simple metrics, for example, around animal product consumption, because obviously animal product consumption can be beneficial or it can be harmful depending on how much is consumed, what type of animal product, and so on. So developing metrics is going to be, I think, an important issue for discussion over the months to come. One simple metric might be fruit and vegetable intake, because we know that lack of fruit and vegetable intake is a major risk factor for ill health, and WHO advises 400 grams a day. And of course, if you are consuming more fruit and vegetables, then that might displace animal products partially from the diet. So that might be a positive indicator that could be advocated and worked on. Water and sanitation is going to be important because obviously of the climate change risk, and also because many societies are depleting aquifers, for example, and those coastal populations that are threatened by extraction of groundwater and also sea level rise from climate change. Some of those water supplies are being salinated. So it's very important to redouble the efforts to try to achieve sustainable, safe water supply in the home, and also hygienic sanitation in the household. Up to now, of course, the targets have been largely accessible water supply, not necessarily water supply in the household, and not necessarily safe water supply. And one indicator that's been suggested by some people is also the proportion of income that's spent on water, because we know that paying for water is an important contributor to poverty in many poor countries. Indicators of health of disaster resilience are important, quite difficult to develop. They were referred to some extent in the universal goals that were suggested by the UN panel under ending poverty. They suggested that we might try and develop indicators of building resilience and reducing deaths from natural disasters. And perhaps as a variant of that, we could also think about the ways in which health facilities could, in hazard-prone areas, could be made more disaster resilient for climate-related disasters, and also the proportion of health facilities with reliable clean energy and water supplies in emergencies. Sustainable cities are important. They don't feature very much, although they're mentioned in the UN high-level panel report. I guess that's because many cities are not necessarily, they have their own administrations, and so some of the drivers of sustainable development in cities are not necessarily directly controlled by governments. But I think we should think about the whole sustainable development process as being a kind of core of indicators and goals that are relevant to national governments. But perhaps we should also be challenging local governments, city administrations, to also develop their own set of indicators that could help mold the development of sustainable cities, because after all, that's where over half the world population are living now, and even more will live in the future. So we need to think about indicators that would combine, as I've said before, link health with sustainable development. Things like proportion of urban journeys that could be walked or cycled, or public transport could provide them, injuries per 1,000 kilometers, fine particulate air pollution, and so on. And we know from the recent GBD estimates published in the Lancet last year that air pollution is really a major a factor for ill health, and it was probably underappreciated before. But they estimated that household air pollution from solid fuels was responsible for around 3.5 million deaths per year, mainly women and children, and ambient fine particulate air pollution for over 3 million deaths, with some overlap between the two categories. So both of these are really important to focus on. And of course, we do have good measures of ambient fine particulate air pollution in an increasing number of sites around the world. And it's relatively easy in surveys to collect data about the source of household energy, whether or not households are using clean energy or not. So one might think again of looking at urban housing, and the MDGs, of course, there was reference to urban slums, and perhaps increasingly we need to focus on combining housing for poor people with healthy housing. So thinking about how we can develop housing at low cost, accessible housing that includes the basic essentials for healthy life: safe drinking water, clean heating and cooking, and resilience to heat and cold, for example. So we've heard about the potential single health SDG. Life expectancy is very widely available, but it is slow to respond to change, and of course it doesn't assess health. Healthy life expectancy, again, is not familiar, as we've heard, to many policymakers, but there is increasing availability of this as a metric. It is a more holistic measure, and it does seem desirable, at least in the longer run, to try to ensure that more national statistical agencies collect data about healthy life expectancy so that we can judge just how effective we're being at maximizing health throughout the life course. And of course, both universal health coverage and the environmental and social determinants of health do contribute to this. So I think what we can say in conclusion is that I think there's general consensus that we have to build on the MDGs. They have, I think, undoubtedly helped to focus international and national efforts. They haven't been achieved in all countries. It's been very patchy, but it certainly has focused some international and national attention. I think we do need to develop better metrics of monitoring progress towards universal health coverage. Some of the MDG indicators can help in that respect. But important to our discussion tonight, we need to develop indicators of health in all policies, or perhaps health in all sustainable policies, one might say. That can reflect policies that both reduce environmental damage, for example, by reducing greenhouse gas emissions, and improving health, and I've indicated some that might fulfill those two roles, and or increase resilience to environmental change, including climate change and other environmental stressors. So I'll stop there, but obviously very happy to answer any questions. Thank you very much.
Thank you very much, Dr. Haynes, for another wonderful presentation. Thank you to all three speakers for really exceptional jobs, not only providing us with incredible information, but also everybody finishing right on time at 20 minutes. As a moderator, that's my greatest joy. So, Dr. Haynes, you've raised very interesting questions about whether under the name Sustainable Development Goals, we are really setting our targets in a range that will truly lead us to sustainability in a world of climate change, given our growing understanding of climate change and its impacts. We are ready now to entertain questions from the group, and we would like to take questions for Dr. Haynes first because of his own schedule constraints. So we have a small audience here in the room, and we have one question, it looks like, from the listening audience. Is there anybody in the room who has a question? Okay. The first question that we have then says that in somewhat contradistinction to the point I had just made, that perhaps the goals aren't strong enough for sustainability. The question is that the goals are lofty and appropriate in a utopian world, but in the real world, with increasing population, increasing poverty and unemployment, and widening gaps between rich and poor, how are we really going to achieve those goals? And I don't know if that's a question specifically for Dr. Haynes. I'll give you the first shot, and then see if Dr. Ramanathan and Mr. Norris want to also answer. Well,
that's a very good question, and I acknowledge that it's not going to be easy to make progress. I think it is going to be difficult to get emerging economies and indeed high-income countries to kind of curb their lifestyles in order to facilitate sustainable development for much of the rest of the world. So it is going to be extremely taxing, and of course we are seeing that already. But at the same time, we have to be ambitious, because I think most people who've looked at the evidence would accept that it's not really credible to be aiming towards, for example, a global average temperature increase of 4 degrees by the end of the century. So that's global average. That's not over the land mass. That's going to be even greater than that. In urban centers, it will be greater than that still, because of the urban heat island effect. So it may be difficult, but at the same time, to just accept the trajectory in which we're on and say there's nothing that can be done, so that we're just going to hold up our hands and say we'll just carry on developing on the trajectory we are, I don't think that's acceptable either. And I think that some of the policies that need to be put in place are actually not so draconian. I mean, there is one of them obviously is reducing fossil fuel substitutes, which could make a big impact. The cost of renewables is dropping all the time, and the more we exploit them, the more rapidly the cost will fall. I think actually one of the biggest challenges, though, is in the food and agricultural sector, because food and consumption of food, diets, is very culturally specific. It's also very much a matter of personal preference. And I'm not aware of any society which really has tried to change or modify diets on a mass scale. Of course, diet has changed as a result of changing availability, of changing knowledge about food. I am aware of a few initiatives. For example, there's the town of Ghent in Belgium, which has mounted on a purely voluntary basis a one-day, a meat-free day during the week, which is something that the local government, the local council, has pioneered, and they've got voluntary take-up by many of the town's restaurants, by many of the town's institutions. There's a high profile of the initiative in the city of Ghent in Belgium. So things can be done locally, and that's why I think that, as well as this important governmental process, we ought to be challenging local governments, city governments, to be doing more ambitious things, because sometimes it's easier to change policies at the local level than it is at the national level. And I think of my own city, London. I mean, we have congestion charges. A few years ago, it would have been unthinkable that we would have charged people to drive into central London. Now those charges exist. They're not a panacea. They haven't solved all our traffic problems. We are seeing an increase in cycling. We're still seeing too many injuries of cyclists, but there has been quite a substantial change in transport patterns in my own city, in London, in recent years. Still a long, long way to go, but we're beginning to see some changes. So I think we have to have an ambitious approach, not just think about top-down government policies, also think about challenging local policymakers and local politicians. And that's, I think, where there's a role for public health professionals working with local government to kind of implement some of these changes, which, as I say, I think are more feasible sometimes at the local level than down at the global level or the national level.
Or actually, I have you here in eyesight, so I'll let you go next.
Yeah, just in terms of the question of feasibility of all this, I think the panel members and the Secretariat put a great deal of work into trying to come up with goals and targets that are ambitious but achievable. And I think that as you look at it, that there were a number of things that were included because we thought that the international community and member states could bend the curve and get there, and some things that were very deliberately left out because we didn't think we could get there in a 15-year period. The extreme poverty measure was set at 125 a day because we think we could probably get there all but small pockets in 15 years. At $2 a day, I think there was pretty broad agreement. We just couldn't make it. There was agreement to put in ending preventable childhood mortality because we thought that was potentially achievable within 5 years. Ending preventable maternal mortality, a hard look at the numbers, nobody really thought that was possible within 15 years, particularly given how stubborn it has been trying to move that particular target in the original MDGs. So, I think there has been a balance of practicality in all of this, and I think the general approach to setting the agenda, as it was with the original MDGs, is to try to take the arc of where the international community, key sectoral actors, what they're trying to do, what they're trying to achieve, and push it out another 10%, another 15%. What could you do with some more money? What could you do with more focused attention? Recognizing that it is not going to be an end to all of the world's ills, but that we can, as we did with the MDGs, probably get further than most people think we could.
Thank you very much. And Dr. Ramanathan, did you have anything to add?
Sure. I think just briefly to add what the others have said is that we need to look, as I said, at the sort of implementation science of goals and targets. Goals don't only exist in the grand global cities. Goals and targets are used at the local level, at the national level, and they're not separate from the other sort of business of politics at local and global levels. Even the critique of the MDGs didn't come out of nowhere. it did actually, in terms of what was selected, came out of the sort of agreement and momentum that had happened over the preceding decade. And really, if you look at the MDGs that work better, they were the ones where there had already been a lot of movement to make progress on, and the MDGs built on them. You can't expect this sort of agenda just to parachute out and solve everything if there's not the momentum already there. So that's one point. The point is, though, that the goals like this need to sort of straddle the line between being pragmatic and feasible, being ambitious and aspirational. A lot of what we've seen with the MDGs, a lot of it you wouldn't have thought was possible. We didn't necessarily have the data. We didn't necessarily have the coverage of interventions. But by having these goals and the around them, that generated a lot of new investment, new resources, new monitoring systems, new mechanisms to deliver services. So by having these high-profile goals by themselves, they can make things feasible that weren't feasible before. I do think I can see the work of the high-level panel. What I would say is that there are a lot of targets for which there aren't a indicator. Often it's been identified what needs to be done, but whilst not everything in the world can be described by a quantitative indicator, I appreciate that, but there is a real challenge when you don't have a sort of quantitative target measuring progress. And one of the real strengths of the MDGs was the ability to compare progress. So I have no doubt that this agenda will be more comprehensive and more universal than the MDGs. The real challenge will be not to just end up with too many utopian goals where we can't use this to track work that's already happening. Like, for example, if we put a target on climate change in the post-2015 agenda, but that may help to bridge the sort of the divisions we see around the Framework Convention, but it may not by itself just be sufficient to solve those challenges. So the framing the targets, it's really important to be very sensitive, not just of the technical feasibility, but the sort of political landscape into how this new agenda could contribute forward on these key issues.
Of other questions, so I'm just going to ask both our questioners and our answerers to keep both brief and succinct as possible. And our next question comes from the room, Dr. Luis Galao of the Pan American Health Organization.
Thank you, John. I have a question. One of the differences we see between the 1992 framework for sustainable development and this one now that's put forward by the UNDP is this dimension of security, human security. We didn't have that in 1992 as a dimension, so we have the social, the environmental, the economic, but we don't have the security. So this is a new thing. Most of the security in health has been translated in the international health regulations, and most of that are really environment dependent. I mean, either by chemicals or by biological means, that's a kind of threat for health and for the entire humanity. Also, there are other things related to human security, like violence, intrafamiliar violence, the street violence, which sometimes prevent people to really use the nice environment they have. So I was wondering, because everything I have seen on this post-2015 on health, talk about universal health coverage, talk about NCDs, which is pretty much things that is on the top today, and talk about this health life years, but nobody really has mentioned this dimension of security, which is quite an important dimension for the international public health community, particularly for environmental health. So that's my question. What is your opinion on that?
Great. And once again, we'll go to Dr. Haynes to see, do you have an answer for that?
Well, I think, as I interpret it, security is in some of the recommendations of the UN high-level panel. I mean, for example, Goal 5 does talk about food security, which is a very, very important aspect of security. Goal 1 talks about building resilience and reducing deaths from natural disasters, which I see as a way of improving security. And indeed, you could see the improvement in health care as building security in as much as it might reduce people's propensity to catastrophic health expenditure. And finally, there is also discussion about the importance of reducing violence in the amongst the universal goals of the panel. So I do see that, in fact, they are addressing security in a number of ways. Of course, one could always argue for more, but I think it is a kind of cross-cutting theme within some of the recommendations of the high-level panel. And I'm afraid I'm going to have to sign off now, so I'm going to say goodbye to everyone, but I've very much enjoyed participating in the discussion, and thanks to the other speakers for their excellent presentations. Thank you.
Very much, Dr. Haynes, for your participation and wonderful comments today. I'm going to turn to my left, and John Norris.
Yeah, I think the issue of peace, stability, and those pressures that push families and individuals back into vulnerability are very prominent in the report. I think they will be contentious going forward in intergovernmental negotiations. I think less so on the resilience and kind of social safety net side, but as you talk about the number of people that die, violent deaths every year, I think that obviously that goes to some prerogatives that some member states will argue shouldn't be in this kind of product. I think it's downright criminal that the world does not keep an accurate database of how many people get killed violently every year in each country. I mean, the number of things we measure with acuity around the globe every day, that we don't count how many people will get killed in violence is absolutely appalling to me. And I think that even improving the data collection would be a very significant achievement for this process. I think that Kumanan also pointed out an important thread of some other areas that go to this exact point that you might not notice at first in looking at the targets. Giving people a right to a legal identity, dealing with issues like a universal right to hold and inherit property. Those are very important things when you look at a developing country. Make it so you can access social services so that if your husband dies, you aren't cast off into poverty or have to do day labor because you lose your farm or lose your land. I think those are very powerful, and I've been pleased that they have been not particularly controversial. But even the word security, anytime you say that, in New York or among member states, that right away they automatically go to discussions of the Security Council, Chapter 7 authority, even though the things that we're talking about are in no way related. So I think there's a heavy perceptual burden to bear, unfortunately.
And thank you very much. And Dr. Ramanathan, very short answer. I have one more question I would like to get in.
Sure, and I think essentially this. Thank you, and actually you voiced Dr. Galval. I think you're actually talking about a sort of traditional understanding of outbreaks, of environmental threats, which I agree perhaps haven't as much prominence as you might have thought. The consultation, I mean, what I reported, these were the issues that attention. I mean, there was quite a variety of papers that a lot of issues. So I do think those issues of sort of outbreaks, for example, air pollution from forest fires and the sort of cross-border threats haven't been addressed as they might. I think the main focus on security has been the poor progress we've seen in conflict and post-conflict, the impact of violence and armed conflict. That's where we've seen the least progress in the MDGs. In that aspect of security, that's where it's an appropriate focus. But perhaps it's just a reminder in all of these things for us to need to be as specific as we mean when we use terms, define them clearly, and try and to get very specific targets that people can understand.
Excellent. Thank you very much. The last question from our listeners is a very, it's kind of a quick answer question, and given the importance that we've discussed about local municipalities, local governments being able to put in place some of these goals and policies in a more rapid and accelerated fashion. The question is, are there toolkits available that one could use in engaging in discussions with local municipalities? Are there resources available for people to be able to engage their cities on these issues?
Yeah, I don't know if there's something that kind of exists off the shelf immediately, but the idea of sustainable cities, the role of municipalities in the post-2015 agenda was very prominent in the discussion. And I think it's also an area where there needs to be a substantial data collection build-out if we're going to be effective. We need much better subnational data if we're going to begin looking at kind of major city-states as a focus for trying to achieve these goals. I think that's where we're headed as the international community. I think it makes sense, but a lot of work needs to be done to be able to look at a city of 10, 15, 20 million people and have the same kind of granularity and data that we've used effectively at the national level.
Thanks. And I'm going to take a little moderator prerogative and just point out that there is an organization called ICLEI. It's ICLEI, and I'm afraid off the top of my head I can't remember what that acronym stands for, but this is an organization that is dedicated to assisting local governments with sustainability, and if you go to their website, you will find some toolkits and resources that I think will also address the needs. With that, I think it is time for us to close. This has been really an outstanding set of presentations. Many, many thanks to all of our speakers. I think we've been given a lot of ideas as we move into this next phase of the development of the post-2015 development agenda on how to integrate health and especially and specifically environmental health in a lot of the different indicators, goals, and processes. So we look forward to seeing how it all plays out. For those of you who want to check in on this information in the future, you will be able to consult the Institute of Medicine's webpage and there be able to access today's speakers' presentations and a recording of this webinar. And also you will be able to access there in the future the summary report from the webinars, the excellent series of webinars that we've had this year. So with that, we will close out. Thank you to all who have been listening. Again, thanks to our speakers, and finally, many thanks to PAHO for excellent hosting of the webinar series this year. And everybody have a good day.